Heart Month is an international effort to raise awareness for conditions that really affect everybody's hearts, including children. And one of the doctors who puts their whole heart into caring for those patients is with us now, Dr. Pearson. Thank you so much for joining us today.
Thank you.
What are some of the most common heart problems that you see?
So I would say in our country, the biggest cardiovascular issue is the obesity epidemic. Occurs in 1 in 5 children. And children who have issues with obesity are at higher risk for having obesity and therefore higher risk of high blood pressure and diabetes going into adulthood. In addition to that, there's also a category of congenital heart disease. That's about 1% of the population. The majority of those are children who are born with maybe an abnormality, one of the valves, or a hole inside of their heart that shouldn't be there.
What are some symptoms to look for, especially in younger children that can't necessarily talk yet?
Sure. In infants, maybe around 1 to 2 months of age, some children who have a large hole in their heart may have difficulty feeding. Eating becomes more difficult for them. They're breathing faster, having trouble gaining weight. Older children, we might have complaints of palpitations or fainting. I think the important thing is to talk to your pediatrician and see if cardiology referral is appropriate for your child.
When are these heart defects not detected before birth?
Well, there can be a number of different scenarios when they're not detected before birth.
Because a lot are, correct? A lot can be found, or?
Yeah, there's a lot of screening, screening guidelines that have been implemented in the last 10 to 20 years in particular that have really helped us identify those heart defects in newborn babies that would be potentially life-threatening or cause major problems if they weren't identified. And we're doing a lot of things nowadays with prenatal screening to try to identify congenital heart disease. That being said, I can't find everything. Medicine is not a perfect science, so we're doing the best we can. I think we do a pretty good job.
Okay, and one more question for you. A new clinic just opened for people with heart disease that we want to mention?
Yes, so February is Heart Awareness Month, but it's also Marfan Syndrome Awareness Month as well. Marfan syndrome and other related diseases is a category of mixed connective tissue disease. So connective tissue is what sort of keeps our body together.